just after midday, I was alerted to a positive COVID-19 test result in Auckland. This case was identified when the person presented to their GP yesterday, Monday, with symptoms and was tested. So, to start with, I want to thank both the person who has tested positive and, of course, the general practice. We can only act on cases if we know they are there as soon as possible. The case is a 58-year-old male from a household in Devonport on the North Shore of Auckland. He became symptomatic on Saturday, the 14th of August, so the infectious period is considered to have started on Thursday, the 12th of August. Importantly, and this has been fundamental to our advice to the government, at this point there is no obvious link between this case and the border. Whole genome sequencing is being rapidly carried out at ESR's Auckland laboratory for this case, and we expect to have the results through in the early hours of tomorrow morning. The whole genome sequencing will help us learn about this infection and whether or not it is confirmed to be one of the Delta variants we have seen overseas, and it should also give us information about potential links to other cases. You will be aware that every case that we have in New Zealand in managed isolation, the sample goes to ESR for testing, for whole genome sequencing. That's not always successful, but we have a database, of course, of all the previous ones that have been sequenced successfully. So it will help us with our source investigation. In the meantime, as the Prime Minister said, we are assuming this is the Delta variant, as all of the genomes sequenced over the last at least 3 weeks, and in fact all but one since late June have been Delta variant. The person lives with his wife, who was also tested yesterday, and yesterday returned a negative test. Both individuals have been self-isolating at home until this point. On their earlier movements, the couple travelled by private vehicle on Friday the 13th of August to Coromandel Township and stayed the weekend there, returning to Auckland on 15th of August. The case has a small number of workplace contacts who are isolating and being tested. The man is not vaccinated, but was in the process of actively booking his vaccination, had trouble with the website, but had been making efforts to do that. His wife is fully vaccinated. I do want to commend the case for being a frequent user of the New Zealand COVID Tracer app, and this tool has helped very much in helping us speed up identifying locations of interest.